Hello and welcome to Aware and Care, your weekly prescription with Dr. Ambika Nair, co-founder and chief consultant at Santhigram group of companies. We brought the series Aware and Care as just the topic suggests about information and symptoms of certain diseases and conditions that most of us face in our daily lives. And there are certain simple remedies that are available through the kitchen, back door, your backyard that can heal your body. In today's episode, we're going to talk about a very concerning topic. Globally, it's on a pandemic. No, we're not talking about COVID, but we're talking about anorexia in children. To know more about this condition and what it is and what effects it has on everybody in the family, let's welcome Dr. Ambika Nair. Namaskaram, Doctor.
Namaskaram.
Dr. Nair, I have just let out the topic anorexia, and especially in children. Our biggest concern as a parent or as watching young children is they are not eating enough. We see them irritable. We see them, having weird behaviors. We see them staying alone. We see them eating every 5 minutes or opening the fridge 20 times a day, but yet they are not gaining weight and a lot of other factors are coming. What is this term anorexia and why are we so concerned about it today?
Actually, it looks, everybody comes and tell, my child does not eat well, doctor. It's a quite common, heard everywhere. But not taking sufficient food when they eat and common eating disorder. It's very common in children, actually. Especially it is called, like aruchi. There is no, like they don't feel any taste in this. Okay. But it is called anorexia in the, medical terms. Problem looks very simple, but it leads to very, very, complicated issues if we don't take care in time. It can be life-threatening also. That is more important, actually, and psychological aspect of the child.
Okay. Now, you mentioned psychological aspect of the child, and in Ayurveda and every series, we are talking about body, mind, soul coming together in Ayurveda form of treatment. Anorexia has become a talk of the town for the last many decades. We want children to be healthy, nutritious. There's weight, there's mental health, there's physical activity, which all come together. So what are the first symptoms a parent should cite out to know that there is a problem with the child?
Very irritable, symptoms are, it varies from children to children, like marked weight loss will be there, inability to gain weight in relation to the age, in proportion they are very, they will always have very less weight. Okay, that is more important. Intolerance towards, any cold objects. They cannot. They feel very fragile children, very low immunity. Some children, they catch cold and cough very easily, stomach, disturbances, fatigue will be there, lethargy, they don't like to play, very irritable. Okay. And you can see, they get into little depression, fear, hair loss. In general, what you can, if any wound is there, you can see that it takes a lot of time to heal it. Then another thing is that the children get in girls. If the things goes like this, it takes a lot of time to initiate their periods, actually.
Okay.
Yeah, fear will be there. Yeah.
Yeah, anorexia, what we understand usually is coming from social pressures. But what I understand from the starting of this conversation, it's not only about socially your appearance to be, in a particular body frame, but it's also something to do with psychological aspects, something an underlying, factor in the heart or mind, which is bottled up by the child or this young adult is showing on food. Is it only about the appearance or something else is also happening here?
No, because some children, because they are very thin, they're genetically prone to get anorexia also. The lack of teaching, we have to, that's why the mother's role is there, because we have to teach the techniques, how to eat, by laughing, the care what the mother gives. And, some children, you can see, if they like one monotonous food, one particular food, they will only eat that. Excessive indulgence in that, actually. And childhood depression, some episodes must have happened. Somebody must have forcefully fed the child or vomited, some children, they don't like even milk. Not only that, because it will not digest or anything like that, because forcefully given, so they vomited 3-4 times like that. And, acid reflux, you can see, because this is all, stomach related things. Fear towards food. And, so many food because they don't like it. Especially, see our Indian, Asian children, because this school, when they go, they come and tell, Whatever they take to the school, they bring it back. They don't eat. Because different types of food the other children bring. So we are very particular that we cook the food and send them. They may not like it. Sometimes the smell also children doesn't like it.
Okay. So these seem to be like warning signs as to what the parents should be noticing about, whether this is an early sign of anorexia, and not that every symptom mentioned here is a sign of anorexia. Friends, please do understand that everybody does not go through all the symptoms. These are certain signs that you should keep watching. And if it is the frequency is increasing, that's when you approach a doctor or take a medical intervention here. Now, Dr. Nair, what is the age group that you've often seen, especially in children, anorexia coming in?
Like 2 year, 1.5 year, like that, because the children, they want to play, because very young children, they come to us.
Okay.
Parents are so much worried because some children, because if the cough or those are some children with any like asthmatic or any problem like that, cough and cold or anything like that. So some children, but then we treat for that, we take care of them and that will be fine. But the reason also has to be taken care. Some children with a very severe constipation, okay, they go once in a week like that. So constipation is also one related issue for this, because this is all stomach related things. How we take care, especially, indulging hobbies, we tell that that's why the toys are given to the children. So what they like, they'll be playing, while they play, we can give them little food, but not the mobile or any iPad or anything like that. Okay, so and put up the TV when they will be eating, storytelling, rhymes, all those things. We have to see that their behavior has to be calmed down, caring them a lot, not forcefully feeding.
Okay. So I was not even sure that I would get into an age group as early as 1 and 2, because mostly, like I said, many a times during the program, so many myths are debunked here. And I always thought it was basically about the teenagers and appearances and, apart from an underlying health condition, many of the young kids are facing. But as early as 1 and 2 is also something which parents should observe. And you very rightly said that it could be something they're having allergic to it, acid reflux, or, stomach upset because of certain foods that they avoid thing. So Dr. Nair, once we come to understand this, that the child is going, do you think it's always starts with a medical diagnosis, or parents should always
they care much more better than going for a diagnosis? You understand? We have to see what the child likes, different way of cooking, understand what he likes.
But Dr.
So it's
Nair,
also intelligence level, we have to see that so some children, they don't like, they like only grinded foods. Some children like, all raw food. But to see that whether it digests for him and all, we Indians, we know much, but now the lack of time, that is more important these days.
That's an important point. Yeah.
Yeah.
So it could also be the texture of the food that the child is not liking, or the young children are not liking.
Yeah.
So, but
texture is also one of the reasons, but we can always, modify it according to their liking, but, we have to see that they are getting a nutritious meal.
Okay.
Yeah.
So when we talk about, always cooking or getting food where the child likes, at certain point, the parents are tired, exhausted, trying all remedies. They say, you know what? End of the day, he's eating chicken nuggets whole day. It's okay. At least some protein is going, some food is going. And they get to a point where they have a war when it comes to the food table, and they say, okay, fine, you want, tacos every day, just eat it as long as you're eating. Now, how do you handle the situation? It feels more like the parents have to be deeply involved with themselves also, mentally and physically, with the child's meal plan. Time is a factor that you mentioned.
Listen, because actually tackling the child, that is rearing a child. It's not easy. Because that's why, before pregnancy itself, you have to make room for the child. You are going to, becoming a mother is a big, responsibility. It's not an easy job.
So that's where father's role also comes in. So Dr. Nair, what are the early conditions that happen to a body that is going through anorexia, apart from these symptoms that lead to anorexia, which show that the kid is having anorexia? What happens to the body? Which organs start getting
very, like a digestive also, liver, whatever he's eating, he will not, that, like vomiting will be there. Or nauseated feeling, they don't feel like eating, they don't like it. Okay, so we can, see in India what we do, we always give little ghee. Even though so many children with milk intolerance and all, but still you can give this ghee. Ghee and pinch of salt. And pinch of pepper, very little pepper. If you just mix it and give, the child will really love it. Pepper, don't put so much of pepper. I told you very little, even less than one pinch. Okay, so this helps a lot actually. And see that if the child has taken a meal, don't give anything at least for 2 hours. Let it, like a perfect timing has to be adopted.
So what happens to the brain when somebody is going through anorexia? Physically, you're weak, you're constipated, or you have all the other symptoms that you've mentioned. But what happens psychologically to somebody with anorexia?
Psychologically, focus issues will not be there. Focus issue will be there. Whatever we command, they will never do. All the tantrums will come. So much of, like crying, howling, very irritable. They will never listen, running around the house, because so many other complications, like we can see that because they don't want to listen to the parents because they are afraid also what they will be feeding them.
So apart from physical attention to this condition, friends, I think there's a lot of psychological support that is required for a child who is going through anorexia. And I'm sure as you are not eating, you're not getting complete nutrition, your appearance and body image issues also start coming up. And of course, there's a lot of social pressure and questions start coming up as to what is happening to the child. Now, when your hair is breaking or you're getting acne because of lack of nutrition, somebody is definitely trying lots of OTC products. I think that is also some symptom that parents should be watching out, that why the child is having so many cosmetics to cover up the appearance or to look more fresh and supple. So Dr. Nair, from an Ayurvedic perspective, how do you actually bring a child to an Ayurveda clinic or to a team of doctors to make them understand that there is a problem?
Parents, only addressing the parents.
So you would suggest that the parents should come first and meet you, or
then what? No 2-year-old can come, no 3-year-old can come. Only parents will bring them. So we educate the parents only. And if the child is older, like a 6 years, 7 year and all, from 5 at least, from 4 years and all, they try to understand. We make them understand, but in a very, like I like children a lot. So I love to address the children. So it's very easy also for me, like we make them, like this is good, but I ask what they like, sometimes they will tell, okay, so modify the food. So we can always include, what we wanted to give in their liking. So that will improve their appetite and they like to eat also.
So apart from the treatment options which we are coming to at Ayurveda, it is more about having counseling here and being very, very patient. I think patient, and this particular problem or condition needs a lot of patience from all the sides, right, Dr. Nair?
Yeah, counseling the parents actually.
Oh,
responsibilities has to be given equally to the parents. Okay. Another thing, we tell them, that because eat together, sit together and eat. So, we are making him understand how to eat it. So nowadays, like most of the parents have really adopted it. So that maybe little bit they start eating. Their table is set. Very young children. Even 1 year, like even you can see that 8-month-old and 9-month-old, they try to put the, like a gruel in their mouth. We have seen a lot of. Anyway, that is very good these days.
Okay, so now let's start by some surprises that you have seen when a child is coming for anorexia treatment. Anything that caught your attention? You said, what, this is a new trend which is happening, and definitely our viewers should come to know about it. That it's not the typical symptoms that you're watching. Any surprising cases that have come to you? Which you
it's like very some children, like a 6-year-old and a 7-year-old, 8-year-old, like according to their age, their growth is not there. We have a lot of children like that. Okay, very thin, very fragile. Okay, very restless. They don't sleep. They don't want to. They want to play or like a destructive mentality. So that all comes in a different group actually. But they don't eat. Some days they like only salty food. What they like, they will eat. Some children like only pasta, but eating only pasta. But that is also, it has to be nutritious, right? So. Making the child also to understand, but they will never understand because those 9-year-old and they will never listen. So we educate the parents only. They may like pasta, but in the different way how to cook it.
Okay.
What to put, what ingredients to put, that is more important. Okay. And we have like a very good medicines also, like Arvindasam is there, Balamratam. There are so many things. Don't give so much of sugar, like all those things we tell them.
Okay. Now, you just mentioned a couple of medicines. So let's quickly start on the treatment process at Santhigram. What are the basic things involved apart from counseling and talking to the child?
Yeah, we give them oil because no treatment, no Panchakarma is needed, especially when they are very young. Okay, if they are above like in like 9 year or 10 year like that, then only we go with the Panchakarma or anything like that. But we give them to, what to do at home. We give them oil so they can apply. So that is the homework for the parents. Okay, so they can, like a whole body, Abhyangam means, it will improve the circulation. They will be able to sleep, their digestion increases. And we tell them to do little, like what they can do, like a dinacharya, nasyam will be given, and application of oil on the head. And even like so many, like we'll be giving some oil also, some preparations. Some children doesn't like all those things, but still we make them understand. It will help you. It will make you more handsome. You understand? So like luring them into the, counseling, then they become very good actually, because we should not get angry with them. We will tell that you are always doing a good thing, but where we went wrong, we are going to correct you from there.
Okay. Now, how difficult are these medicines to take? Because there's an impression that all Ayurvedic medicines are very, very bitter. It's very difficult.
No. We are not going to give them so many medications. The Ghrida preparations are there. So we can give them like 1 teaspoon, half teaspoon, even quarter teaspoon. So slowly you can see that how they improve their health. Okay. It's very, very fast actually.
Okay. Now, Dr. Nair, there's a question coming up that do children with anorexia, do you often see them bloated also?
So much bloated, because that's what I told you, they are afraid acid reflux will be there. And some children will complain of chest pain, all this, because this is all like a psychological issues, they are afraid. Yeah, forceful feeding, sometimes, see, if they are in the school also, they are afraid of the teachers. When they open the, their tiffin box, they will tell that you have to eat it. So that is also, then they don't like to take it. So they go and put it in the dustbin, like that.
Okay. And what is the recovery time for somebody with anorexia?
It all depends upon the case to case.
What is an average time? Because I know parents are very anxious. And
maximum 3 months, I think, because I have seen that 3 months, it makes a lot of changes in the.
Oh, this sounds very interesting and very, very hopeful. Friends, today's episode, we are keeping it very brief and short. Like, we know that this is a very sensitive topic, because the more we talk about it, there will be many questions which are coming. And there are certain questions and answers that on a public forum, even if the child is listening, may find it very, very uncomfortable. But the hoping message here today is that anorexia is definitely treatable. And as doctor suggested, you should definitely be reaching out, and maybe before you bring the child to the clinic or to any doctor of your choice, you should at least first have a counseling yourself and understand the family circumstances and situation why the child is not eating, and including teenagers. Teenagers definitely do understand, like Dr. Nair had just mentioned. Any parting words that you want to share, Dr. Nair? Like I said, we want to keep the episode very brief because there's a very, very detailed subject. Any exercise routine or something, sports?
Exercise, physical activities, we tell them to do it. Actually, they can play outside. Child should play outside, making the child to play outside. Physical activities are really needed, like swimming. This is all very good. Not only sitting and reading 24 hours.
Okay, because I think
talking to their friends, taking them out, like they like to go for vacations. So making them little mentally happy. And not only that, this I have seen, when they are in a group, they like to eat little more. And when they go to the friend's house and all, they will like to eat more. But with the parents, they don't like to eat.
We have to rent parents weekly basis, especially. And you also see that, we should encourage those group eating habits, especially among the children, not only with the parents, but, maybe their circle of friends, invite them and have a little, maybe broccoli party or a carrot party or something.
Carrot party.
Yeah, used to do all that, Dr. Nair, but I'm really interested to know more about this subject. But like I said, we will talk in more details and other aspects, eating disorders in children and young teenagers in the coming episodes. We thank you very much for touching base on this topic today, because I think this was an emergency episode for our viewers just before the holiday season and Thanksgiving meal being set. So we wanted the message to get across that anorexia is a condition that is treatable and it can be intervened by parents as well as the young adults themselves. Thank you so much, Dr. Nair, for today's episode. I look forward to many more with you here on Aware and Care. Please like, share, and subscribe the episodes. And any condition that you want us to talk about, please ping us. We will take it up in the next episode.
Thank you so much.